Have you ever thought that a simple cough, or just a little fatigue, could be warning signs of something far more serious? Most people don't, and that's the problem. I'm Dr. Sarah Bennett, and today we're going to talk about something that's quietly affecting thousands of people over 60. Lung cancer. It doesn't knock loudly. It doesn't scream for attention. In fact, it's often silent, hidden behind everyday symptoms that many seniors chalk up to just getting older. A lingering cough? Probably allergies. Feeling tired? Must be age. Chest discomfort? Maybe heartburn or a pulled muscle. That's how it hides, until it's too late. Here's the truth. Nearly 75% of lung cancer cases are diagnosed at a late stage when treatment options are fewer and outcomes are far more difficult. I've seen it again and again in my practice. Good people, kind people, who simply didn't realize their body was trying to warn them, and by the time they came in, the cancer had already advanced. But here's the good news. If caught early, the chances of surviving lung cancer can double. Yes, double. And the key is knowing what to look for. So in this video, I'm going to show you 3 critical red flags of lung cancer that are often ignored, especially by people over 60. These are symptoms I want you to take seriously. You don't need to panic, but you do need to pay attention. Because when it comes to your health, early action isn't just smart, it could save your life. Why early detection is the key. Lung cancer is one of the deadliest diseases for a reason it hides. Unlike many other cancers, it often doesn't cause pain in the early stages. There are no clear warnings, no dramatic symptoms. Just small, quiet changes in how you feel. That's what makes it so dangerous. It doesn't ring the alarm bells until it's already made its way deep into your lungs and, sometimes, beyond. In fact, over 75% of lung cancer cases are diagnosed only after the cancer has reached a late stage. By that time, the options become limited, treatments more intense, and the road to recovery much harder. I've seen patients come in with a slight cough they've had for months, or tell me they've just been tired lately, and after a few scans, we discover something no one expected. I don't say that to scare you. I say that to prepare you. You see, one of the biggest challenges we face as doctors is not just treating the illness, but convincing patients to take the first signs seriously, especially seniors. People over 60 have been through a lot. They've lived full lives, faced ups and downs, and often carry a quiet toughness. So when symptoms show up, they're more likely to brush them off. It's probably just age, they say. Must be allergies. Or worse, I'll wait a little longer and see if it goes away. And that wait, that quiet delay, is exactly how lung cancer wins. But it doesn't have to. Because here's what the science shows us. When lung cancer is caught early stage 1, or even stage 2, the survival rate can double. That's not hope, that's data, that's reality. Early detection gives you time, options, and most importantly, hope. You don't need to live in fear, but you do need to be informed. The body whispers before it screams, and if you learn to listen closely, you can catch the whispers before they turn into something louder. I want you to think of this video as a check engine light for your body. It's not about panic, it's about awareness. You wouldn't ignore a blinking light on your car dashboard for weeks, right? So why ignore the one in your chest, your throat, or your breath? These aren't just symptoms. They're messages, warnings. And today, I'm going to decode them with you. We'll look at 3 subtle but serious red flags that could point to lung cancer, especially in adults over 60. These are not extreme or rare cases. They're the kind of things that happen to everyday people just like you. So if you've been feeling off lately, or if you've noticed these signs in a loved one, don't ignore them. Watch closely, take notes, and most importantly, take action if needed. Early steps lead to better outcomes. Now let's dive into the first red flag you should never ignore. First sign: persistent cough or a change in your usual cough. Let's begin with the first and most common signone that's easy to ignore: yet potentially life-saving if caught early. A persistent cough, or a noticeable change in the way you usually cough. Now, we all get a cough from time to time. It might come after a cold, a bit of postnasal drip, or just a tickle in the throat. But here's the key difference: when that cough asterisk doesn't go away, or it starts to sound or feel different than it used to, that's when you need to pay attention. In lung cancer, the cough is often dry, nagging, and doesn't respond to typical remedies. You might notice it's there every day, especially when you wake up, or that it gets worse over time. Maybe it changes in tone, becomes hoarser, harsher, or deeper. Some people describe it as a throat itch they just can't clear. Others say it feels like a tightness in the chest, even without phlegm. But the real warning light, blood? If you ever cough up blue, even just a small streak in your mucus, that is not something to ignore. I've had patients tell me it was just a little spot, probably from irritation. Or, I've had a sore throat for weeks. It's probably just that. But blood in the cough, even in tiny amounts, is your lungs saying something's wrong. Whether it's red, rust, colored, or mixed with mucus, get it checked. I know how easy it is to make excuses. I've had chronic bronchitis before. It's allergy season. The weather's been crazy lately. And while those may be true, they're also the same reasons I've heard from patients who later discovered their cough was a symptom of something much more serious. What I always tell my patients over 60 is this: you know your body, asterisk. You know what's normal for you and what isn't. So when something lingers, especially for more than 3 weeks, it deserves attention. You don't need to jump to conclusions. You just need to have the conversation with your doctor. Ask for a chest X-ray, or even better, a low-dose CT scan if you're in a higher risk group. Because here's the bottom line: a cough that sticks around isn't just annoying, it might be your first clue. And if you catch it early, that one simple act, deciding to get it checked, can mean the difference between stage 1 and stage 4. So don't wait. Don't explain it away. When your cough lasts more than 3 weeks, especially if it comes with hoarseness, throat irritation, or blood, listen to your body. It may be trying to save your life. Let's move on to the second red flag that hides in plain sight and often gets confused with the natural aging process. Second sign: unexplained fatigue, a sudden drop in energy. Now let's talk about something that might not seem alarming at first, just feeling tired. But this isn't the kind of tiredness you shake off with a good night's sleep or a cup of coffee in the morning. This is a fatigue that's different. It sneaks up on you, and before you know it, your energy has plummeted, like someone pulled the plug on your body's power source. One of the most overlooked signs of lung cancer, especially in older adults, is unusual fatigue that has no clear reason. You may be sleeping just fine, eating regularly, and sticking to your normal routine, but still find yourself completely drained. Simple tasks like walking up a flight of stairs leave you winded. Grocery shopping, doing the laundry, or even getting dressed becomes exhausting. This isn't the slow, gradual tiredness that many associate with aging. It's sharper, more sudden, and doesn't match your lifestyle or habits. I've had patients tell me, "It's like my stamina disappeared overnight." Or, "I used to walk the dog every morning. Now I can barely make it to the mailbox." That kind of change is worth investigating. The trouble is, this type of fatigue is often brushed aside. Many seniors tell themselves, "Well, I am getting older," or "Maybe I just need more vitamins." But when you're otherwise healthy, eating well, sleeping enough, and staying active, yet still feel this overwhelming sense of fatigue, it could be a red flag. Why does this happen with lung cancer? As the disease develops, even in early stages, it can disrupt the way your body uses oxygen. Cancer cells begin to interfere with normal lung function and drain your energy, even before there's noticeable damage. You may not feel pain. You may not even be coughing. But your body is working overtime to compensate, and that effort is exhausting. What makes this so dangerous is how easy it is to normalize. We live in a world where tiredness is expected, but you know your body. You know when something feels off. And if you find yourself out of breath doing things that used to be easy, or constantly needing to sit down and rest, don't ignore it. It's not about paranoia, it's about being proactive. One checkup, one scan. That's all it takes to rule out something serious. And if it is something serious, early detection gives you the power to act. So here's the takeaway. If you've been feeling unusually tired for weeks without a clear reason and it's affecting your daily life, it's time to talk to your doctor. Not next month, not after the holidays, now. Let's continue with the third warning sign or symptom many people confuse with heart trouble or muscle strain, but that could actually be coming from your lungs. Third sign, chest pain or discomfort, not related to the heart. Chest pain is one of those symptoms that immediately sets off alarm bells, but often for the wrong reason. When people feel something strange in their chest, their first thought is usually, "Is this my heart?" And while that's a valid concern, what many don't realize is that not all chest pain is cardiac. In fact, some of it can come from your lungs, and that's a warning you don't want to overlook. With lung cancer, chest pain doesn't always feel intense or dramatic. It's not the crushing pain you might expect. Instead, it can be subtle. A light, nagging pressure deep inside the chest, or a sharp little jab that appears when you breathe deeply or cough. It might feel like a muscle strain, or even just a sore spot that doesn't go away. And because it's not overwhelming, it's easy to explain away. I must have slept wrong. Maybe I pulled a muscle reaching for something. I probably twisted something in my back. These are the kinds of things I hear every day from people who, in hindsight, wish they had looked into it sooner. What makes this type of pain different is its persistence. If the sensation keeps coming back, or if it gets worse when you breathe in or cough, that's your body's way of saying something isn't right. And if it's accompanied by a cough that won't go away, unexplained weight loss, or a general feeling that your health is slipping, you need to take that seriously. Lung cancer pain can come from the tumor pressing on surrounding nerves, blood vessels, or the lining of the lungs. It might start off feeling dull and manageable, but it rarely goes away on its own. In many cases, people assume it's muscular, or even a digestive issue like acid reflux. But if you've ruled out those common causes, and especially if you've never had chest discomfort like this before, it's time to get a professional opinion. And I want to be clear, not all chest pain is a sign of cancer, but recurring chest discomfort, especially when paired with other symptoms like a chronic cough, fatigue, or weight loss, should never be ignored. Even if it turns out to be nothing serious, getting it checked could bring peace of mind. And if it is something more serious, that early visit could change the entire course of your treatment and your life. So here's the bottom line. If you're experiencing chest pain that feels deep, lasts more than a few days, gets worse with breathing or coughing, or keeps coming back, don't assume it's just a pulled muscle. Talk to your doctor, ask questions, push for answers, because when it comes to your lungs, silence is not golden, it's dangerous. Next, I want to share a real story from my clinic about a man who listened to his body just in time and how that changed everything for him. Let me tell you about one of my patients, Mr. Harris, a 67-year-old retired teacher who came into my clinic one spring morning. He wasn't alarmed. He wasn't in pain. He just wanted to get a second opinion on a sore throat that had been bothering him on and off for a few weeks. At first glance, it sounded like a typical case of chronic pharyngitis. He wasn't coughing up blood. He wasn't short of breath. He didn't even feel particularly tired. Just a little raspy voice and the occasional irritation in the back of his throat. He even joked, "I guess I've been yelling at the grandkids too much." But I noticed something in his history that made me pause. He was a former smoker, hadn't touched a cigarette in over 20 years, but still carried that past with him. He also mentioned that, every once in a while, He felt a strange tightness when taking a deep breath, not pain, just odd. So I ordered a low-dose CT scan. 3 days later, the results came in. Stage 1 lung cancer. Small, localized, not spreading. Mr. Harris was stunned. "I feel fine," he told me. "How could this be cancer?" That's the trick with lung cancer. It often whispers before it shouts. But here's the good part. Because we caught it early, he didn't need aggressive chemotherapy. No radiation, just a targeted surgical procedure and ongoing monitoring. Today, over 2 years later, he's cancer-free and living life with his grandkids yelling just as much and laughing even more. His story is a perfect example of why you don't need to panic, but you do need to pay attention. Listen to your body, get checked, take action when something feels off. Because sometimes, that tiny symptom you almost ignored is the clue that saves your life. How to protect your lungs every day. Now that we've covered the warning signs and seen how early detection can change lives, let's talk about something equally important: prevention. The truth is, no matter your age, there are simple, effective steps you can take every single day to support and protect your lung health. First, let's start with your breath, something so basic, yet so powerful. Deep, intentional breathing can do wonders for your lungs. Each morning, before the noise of the day begins, take a few minutes to breathe slowly and fully. Try inhaling through your nose for 4 seconds, holding for 4, and exhaling gently through your mouth. This not only strengthens your lungs but also helps clear out stagnant air and toxins that can accumulate overnight. Now pair that breathing with a short morning walk. Just 15 to 30 minutes of walking in the fresh air can make a significant difference in how your lungs function. It improves circulation, boosts oxygen levels, and supports the immune system, all while gently exercising your respiratory muscles. If you live in a city or an area with poor air quality, consider walking early in the day when pollution is lower, or find a park with trees and open space. Next, eliminate what hurts your lungs, especially smoke. This includes cigarette smoke, secondhand smoke, and even smoke from wood-burning stoves or cooking with poor ventilation. These particles don't just irritate your lungs, they cause long-term inflammation and cellular damage. If you've ever smoked, or if you live with someone who still does, now is the time to have a serious conversation. Your lungs deserve clean air. Let's talk about food, because what you eat can either fight for your lungs or work against them. Cruciferous vegetables like broccoli and cauliflower help clear toxins from your respiratory system. Turmeric and ginger offer anti-inflammatory benefits and support lung tissue repair. And green tea? It's rich in antioxidants that reduce lung damage and may even lower your cancer risk. These aren't exotic ingredients, they're simple, natural foods you can add to your daily meals starting today. Lastly, if you have a history of smoking, even if you quit years ago, please consider getting regular lung screenings. A chest X-ray or a low-dose CT scan every year or 2 can catch early changes long before symptoms appear. It's quick, painless, and for many of my patients, it's been the difference between a close call and a full-blown diagnosis. Don't wait for symptoms to show up. Be proactive. You don't need a complete lifestyle overhaul. You just need consistent, mindful steps. Every breath you take is a gift. Let's make sure it stays that way. In the final section, I'll summarize everything we've discussed and explain why sharing this knowledge might just save someone you love. Let's quickly go over the 3 early warning signs we've discussed. Signs that could mean the difference between early treatment and a late-stage diagnosis. First, a persistent cough or a change in your usual cough. If it lasts more than 3 weeks, or if you start noticing blood, hoarseness, or throat irritation, don't wait. Second, unexplained fatigue. If you're eating well, sleeping enough, and still feel drained or short of breath from simple daily tasks, that's not just age, it could be something more. Third, chest pain or discomfort that isn't linked to your heart. especially pain that returns often, gets worse with deep breaths or coughing, or comes with other symptoms like weight loss. If you, or someone you care about, is experiencing any of these signs, please, don't ignore them. Talk to a doctor, ask for a scan. It doesn't take long, and it could change everything. And here's one more way you can help. Share this video. You never know who might need it. A neighbor, a family member, a friend from church, someone in your life might be brushing off symptoms right now. By passing this along, you could literally save a life. Because awareness is power. And action early, informed action is how we fight lung cancer before it takes hold. Take care of yourself. Take care of each other. And never stop listening to what your body is trying to tell you. Before we end today's video, I want to leave you with one gentle reminder. Turning 60 isn't the end of the story, it's the beginning of a new chapter, if you choose to listen to your body. Your body speaks in quiet ways through coughs, through fatigue, through small aches that don't feel quite right. Don't ignore those whispers. They are your early warnings, your chances to take action before it's too late. If this video helped you better understand your health or gave you something to think about, I invite you to stay connected. Subscribe to this channel, tap the bell icon, and explore the many other videos we've created just for you, videos focused on living stronger, longer, and healthier after 60. Take care of your lungs, take care of your life. And as always, thank you for spending your time with me. I'm Dr. Sarah Bennett, and I'll see you in the next video.